It's U of L Today on 93.9 The Phil. Here's your host, Mark Hebert.
And welcome to U of L Today with Mark Hebert on 93.9 The Phil. Thanks for joining us today. We've actually, before we get the show started with a bunch of interviews, got a little great news about the University of Louisville. We are number one. Yes, last week a report came out from the USC Race and Equity Center, which ranked U of L the top school in the country for African American students. Now, the ranking was based on national data and benchmarks, mainly the graduation rate among black students, the percentage of African American students in the student body, and the number of African American professors on campus. So U of L President Neely Bendapudi was obviously excited about this ranking, and she shared it with some reporters last week.
This is a report that comes out of the USC Race and Equity Center. And what their mission in this particular study was to come up with a grade of sorts for all public universities across the country to see how we are doing in terms of addressing racial inequities in higher education. We're very excited to be number one, but I'm hoping that it also has a big impact on students when they're looking for places to go. As you all know, we were just ranked number one as the most LGBTQ-friendly university. Those kinds of recognitions tell students that if they come here, they'll be very, very welcome and might encourage more of them to come. I also think it's attractive to all students who want to come and be educated in a diverse environment that prepares them for the world of work. And finally, I think it's a big recruitment tool when we're trying to bring the best and brightest faculty and staff here. Something we really are very keen on doing at the University of Louisville. You've heard me say it will be a great place to learn, work, and invest, because we celebrate diversity, because we foster equity, because we try to strive for inclusion. So it's great vindication and it's great motivation.
That was U of L President Neely Bendapudi talking about the number one ranking that U of L got in a recent study of black students and how they fare on campuses across the United States. So, what do we got on the show today? Well, we've talked about U of L's Envirome Institute, which is looking at pollution and its impact on our health. Today, we'll hear about a study of pollution's impact on women's health in particular. But this first segment of our show is sponsored by Passport Health Plan, which administers Medicaid benefits and has a mission of improving the health and quality of life for more than 300,000 Kentuckians. And these two ladies sitting in front of me, that's exactly what they are trying to do as well. U of L School of Nursing has a robust community outreach program, which includes clinics for the families who work on the backside of Churchill Downs, as well as a new spot in a clinic in downtown Louisville. Whitney, Nash, and Dedra Hayden are both with the School of Nursing. They're here to talk about both of these programs and other stuff. Whitney, good to see you. Dedra?
Good to see you again.
Good to see you. Just missed you at Panera, or saw you at Panera Bread having lunch yesterday. All right, well, let's talk a little bit about just in general, the School of Nursing. Whitney, you do some of these outreach programs out in the community. What have you got going on in the School of Nursing?
We have got a lot going on. We have been very fortunate. We have a new dean, and our new dean is really an incredible advocate for our practice partnerships. She is a clinician herself, and so really has already jumped right in and taken the lead on trying to move that mission forward in the School of Nursing. So certainly with our Kentucky Racing Health Service Center that's led by Dedra Hayden, and then our new partnership that you mentioned with the School of Dentistry, and we've got a couple of other things that are kind of cooking right now, so more to come on that. But I've also been very fortunate. I've taken a new position that's shared, an assistant vice president position for interprofessional practice partnerships. So I think that really shows that the university, and then certainly Dr. Postal is taking this sort of area of healthcare very seriously and wants to see the university move forward in that area.
Dr. Postal, of course, is the vice president for health affairs
on
the health sciences campus. So, all right, well, let's talk a little bit. Let's start with the Kentucky Racing Health Services Center, which Dedra runs. Tell us what that is.
So the Kentucky Racing Health Services Center is a faculty practice. We have 5 nurse practitioners, and we serve the workers, the stable workers and the backside workers at Churchill Downs, which are an at-risk population. We provide them with primary care services at a minimum rate. Basically, the patient has to pay a $5 copay to be seen, and then we proceed to provide them with comprehensive primary care services.
So this is the doctor's office basically.
Yes,
Except
it
you're
is.
nurse practitioners.
Yes, that's correct.
Is it on the backside, or is it off the backside, or near Churchill Downs?
It
or
is actually across the street from Churchill Downs. So our office backs up to Central Avenue on the opposite side of Churchill Downs.
And Whitney, you started this, what,
2005.
10 years ago? No, more than that, 13 years ago.
13 years ago.
13
We're
years.
nearing our
Has it been that
14th
long?
year. I can't believe it. I honestly cannot believe it. I've been very fortunate. Dedra is our third director there. I started it, and then we had Sarah Robertson, and then Dedra's taken charge over the last about year and is doing a phenomenal job. She could tell you probably a little more about some of the expansion that we've had with some of our providers and our services.
Well, when you started this, though, what was the idea back in 2005 when you started this? I call it the backside clinic.
Sure.
And I think that's what most folks refer to
Right.
it as. What was the idea?
So the idea, when I was approached, it was, I call it a Band-Aid station. It was going to be very limited services. Back, 13 years ago, 14 years ago, the idea of what a nurse practitioner could do was fairly limited in scope, certainly limited understanding. But really, we were very fortunate to have the space that we have. We have about 3,000 square feet. And we're able to offer comprehensive primary care. I kind of knew in the back of my mind that once the folks kind of got a taste of what was going to be delivered there, there's a lot of research to show that patient satisfaction is very high with nurse practitioners and quality of care is very high. And so we've been able to really build out a full-service primary care offering.
Talking with Whitney, Nash, and Dedra Hayden from the School of Nursing. We're talking about the outreach programs they've got at the School of Nursing. Specifically right now, we're talking about what I call the Backside Health Clinic, which is just about 2 blocks from Churchill Downs that serves the backside workers. So who are the folks that walk in to your clinic, Dedra?
We serve the workers on the backside clinic at Churchill Downs. They are about 85% Latino immigrants. So you have what we would consider an at-risk population. Patient who have needs that are not met within the public sector, so we serve those patients. Yeah, and if they have to be an employee at Churchill Downs, and if they are, not only will we serve the patient, additionally, we will treat their families as well.
I think it's interesting, too, that when we talk about this practice, this clinic, a lot of people think that it's anyone who works on the backside, but I think it's really important to emphasize the fact that this is not the trainers, the owners, the folks that typically would have health insurance. These are the people that really have limited resources and unmet healthcare needs.
And are most of them traveling with the trainers? I mean, most of the stable workers travel all over the country, New Orleans, New York, Louisville.
And they are migrants. So I think that's where the creativity has to come in as a provider, because you'll have a period of time where you can treat the patient for 3 months, let's say for a chronic disease, and then they're going to go to Florida after the fall meet in November. So you have to figure out a way for them to continue to get their care. And so we have implemented an EMR, an electronic medical record. So we're able to actually e-scribe in other states when our patients need refills, or they can contact us via email to let us know what their needs are, so that we don't kind of backtrack on the success we've made with their care while they're here.
I know you don't have what I'm going to call a typical patient, but if you can, kind of pick out one or two, without using their names, obviously, of a patient or a patient's family that you've seen in the last couple of years, and just kind of, they walked in the office and they hadn't been seen by a doctor in 3 years or something, and here they showed up and they had something that you caught perhaps and maybe saved their life or something.
Actually, we have a pretty remarkable patient that actually Dr. Robertson and we saw this patient together, and he was a hot walker at the backside, and he comes in with what we thought looked like potentially an ear infection, an otitis media, and we continued to assess this patient and found some other questionable things on his skin that made us worry a little bit more, and a lesion in his mouth, which kind of integrates our dental collaboration at the backside clinic. And long story short, after we collaborated with dentistry, we sent the patient for care there, and the patient ended up being HIV positive and did not know it. And the patient presented as a sick patient. And so we were able to take a good look at this patient, provide the good care that we do, get him, the help that he needed. In essence, he ended up having what we call like a Burkitt's lymphoma in his mouth, which what we thought was a dental lesion, and it's basically a side effect of being immunocompromised from the HIV. Progresses very quickly. If we have not had caught that as early as we did, the survival rate of that patient would have been greatly decreased. So we rely on our collaborations and our collaborations with women's health within the clinic, as well as our collaborations with mental health, because we know that the data shows that interprofessional care and interprofessional collaboration, they have the best outcomes.
How many patients do you see in that clinic, in the backside clinic?
Well,
in
and
a
that's
year?
what Dr. Nash was referring to. We are growing leaps and bounds. Typically, when I was a student there, when I was doing my training under the direction of Dr. Nash, and we would see anywhere from, on a heavy month, 50 to 100 patients a month. We are busting at the seams. We had a record-breaking summer. We were seeing anywhere from 200 to 250 patients a year. So,
A year or a month?
excuse me.
I was going to say a month, right?
Yes, sir, a month. So our volumes are like growing. I think the word spreads pretty quick within that community. It's a tight-knit community.
Yeah, so they don't necessarily trust doctors, or they're worried that if they're Hispanic and they're not here legally, perhaps that they don't want to go to the doctor because they don't want the INS to come get him or whatever.
Right. I mean, I think that's probably one of the hallmarks of our practice, is the fact that we have been embedded in that community for the length of time that we have for the 13 years, that finally, and it takes a long time to gain trust in that community. And I think that's one of the reasons why we have seen such an increase is, it's word of mouth. We really do no advertising. And we see a very specific subset of the population. So that have to be, racetrack workers. So now we're seeing family members. I think that's one of the areas where we're really growing.
Talking with Whitney Nash and Dedra Hayden about UofL's clinic on the backside of Churchill Downs. Not actually on the backside of Churchill Downs. It serves the backside workers at Churchill Downs. And their money for this comes from where? What foots the bill?
That's always the question.
Well, that's a good. That's a legitimate question.
It's a very good question. So the money, we are funded through what's called uncashed pari-mutuel tickets on the backside at Churchill Downs. So basically what that is someone who wins a race, and it may be a small amount of money, anywhere from to a large amount of money, and they do not.
They'll cash the ticket.
They'll
Right.
cash that ticket, and then that money is funneled into the fund that supports our clinic.
Okay, and how much is that a year? How many? That's a lot of uncashed tickets. I
It's
guess.
a lot of uncashed tickets. It's in the millions. Of course, our clinic only gets a small
Right.
percentage of that, and it's allocated every year. And so, we really feel like that we can demonstrate that this is a very, very viable, needed resource in the community. And so I think that's one of the reasons why we've continued to be funded.
And it helps U of L students in the School of Nursing, right?
Absolutely.
Absolutely.
How?
It helps several students at the university. Not only we are able to provide preceptorships to our undergraduate students as well as our nurse practitioner doctoral students, we are able to integrate with the Department of Latin American Studies, where we allow those students to do their internships as well. And then we also have a lot of pre-medical students who also do their internships to be an interpreter at our clinic. So we have lots of collaborations going on within the university.
All right, let's talk a little bit about something else you got going on. U of L Cares. What's that?
So UofL Care Partners, just so that we, because I'm going to give a plug of our phone number, but so UofL Care Partners is a collaboration that really started, 4 or 5 years ago anyway, with the initial partnership with the School of Dentistry. And actually, Dedra was a real key element there with that partnership. The School of Dentistry at that time, Dr. John Salk and Dr. Marcia Hearn, the deans of the School of Nursing and of Dentistry, saw the need to really integrate nursing and dentistry, or healthcare and dentistry, at the student level, and felt like that nurse practitioners could really be a key educational asset to the learning of those students that worked in the dental clinic. They all have to rotate, the dental students have to rotate through the clinic. And Dedra really was just a model for that collaboration as far as helping those students understand the need to really do a very comprehensive medical examination prior to getting their dental care. That collaboration grew into the opportunity to be funded for a HRSA grant. And then the idea ultimately was to have some type of a clinical partnership there, most likely at the School of Dentistry. So over the course, and I'm just giving you a little bit of the background though, I think is important to understand, but so finally, we really have been able to move forward with this just shared project. I can't thank the School of Dentistry enough. Our new clinic is located actually in the School of Dentistry, right in off the lobby. And the initial idea was to, while we had those patients that were at the clinic, and
At the dental clinic
who wanted to receive dental care were screened and found to have some type of medical condition that really would not allow them to continue in their plan of care that day. And so they would be referred back out to the community and many times would not return. And we also know the research shows anything that you can sort of co-locate, be it pharmacy, medicine, dentistry, whatever, in one building, the better outcomes you're going to have. So this July, we were able to launch UofL Care Partners, and with Dr. Beverly Williams Coleman, who is our director and nurse practitioner. And she offers a full range of services right there at the School of Dentistry. And this is not just for dental patients. This would be for certainly faculty, staff, students, community, anyone who needed primary care. And so she has really just taken charge of this project and has started to get busy, which is great. And she's offering some community outreach, doing some sports physicals, school physicals, those kinds of things out in the community. And she has 20 hours a week right now, till we build our volume a bit. But yeah, anyone can call in for an appointment, and she'd be happy to see them.
And have you had those people walk into that clinic that went down to dentistry to maybe get their teeth cleaned? They're on Medicaid patients or passport patients, and they go down to dentistry, get their teeth cleaned, and they're looking at them, and one of the dentists says, hey, wait a minute, you got something else going on here. You got some other health problem that you really need to get checked out. Why don't you go over to that clinic, and I'll tell you what, it's about 10 steps from here.
Right. So that is the idea, and that has happened. And we've had people we've done just a little bit of marketing. We're going to really hit it hard the next couple weeks, but to get the word out. We are fully credentialed, so take Medicare, Medicaid, our Anthem, our UofL product, so anyone who's an employee at UofL can access this service, and then other commercial insurances. So just need to call 852-CARE and make an appointment.
All right, and that's right downtown. It's in the dentistry
downtown.
school. So, Dedra, when you were looking at this years ago, when you were trying to get this collaboration going between the dentistry school and the School of Nursing, what was the thought there? I mean, just trying to get everything together in one place, was that?
That was the thought. And the thought was to really not lose those dental patients that had medical concerns. We wouldn't, somebody comes in and they're hypertensive and that impedes them from getting their dental care. We'd send them to get their blood pressure checked and treated. And we were losing those patients. And we saw that as an opportunity to keep those patients within our system, address their needs on site, and facilitate their care a little bit quicker than going out in the community and waiting.
The University of Louisville is one of the leaders in research on how pollutants impact health. Banrida Wahlang is an environmental health scientist at UofL, and she's been looking at how pollution impacts specifically women's health. Banrida, good to see you.
Thank you for having me.
Thanks for being on the show. All right, so what do you study?
So I am an environmental health scientist, and I study the health effects of certain types of pollutants that are known as persistent organic pollutants that are basically man-made or manufactured chemicals that were made back in the 1930s. They were banned by the U.S. Congress about 3 decades ago, but because of their thermodynamic stability and their ability to not degrade in the environment, they persist in our ecosystem.
They last forever.
Yeah, they last forever, and they stay on forever, and we cannot just eliminate them, and they stay in fish and marine organisms and humans. So it's
so these different chemicals that are out there, these bad things that we banned a long, long time ago that are still persisting out in the air and in the water. What are some of them? Would we know the names of Are there common names that we would know what you're talking about?
Yes, so
Like DDT or something like that?
Yes, so there is it's called persistent organic pollutants, so it's a very broad class, but some of them are things called as polychlorinated biphenyls or PCBs that were used in dielectric fluids and transformers, and then like you said, DDT, which is an organic chlorine pesticide, and other compounds that are actually used in our cooking ware and Teflon, known as PFAS or perfluorinated alkyl substances. So,
yeah, right.
Yeah,
yeah, I know exactly what you're talking
Right.
about now, right? And you had worked with Matt Cave, who we've had on this program before, and we've done some stories with him, and he works on how environmental things affect the liver, right?
Right.
So you did some of that work as well, right?
right, yes.
Okay.
Yeah.
And so why'd you move into just this specialized area of just wanting to look at women's health? And
So that's a very good question.
or you don't know. If you don't know the answer, that's okay.
Yeah, actually, I do. So I've worked with Matt Cave for my PhD, and I've done extensive research in liver disease. And about a couple of years ago, I was at a conference in Italy on dioxins, which are also part of the Agent Orange herbicide that was used in the Vietnam War. And so there was I was sitting at a seminar, and there was this presentation that was talking about these health effects in women and how they impact future generations, because women obviously bear children, and because these chemicals don't go away, so they pass on from generation to generation. And I was just sitting there, and I'm like, oh my God, I could be carrying all these chemicals and passing them down. And so that sort of pushed me into that area, and it's actually very understudied, so I think it's very important to have new young people to go into it.
We're talking with Banrida Wahlang, who's an environmental health scientist at the University of Louisville. She's looking at the impact of pollutants on women's health. So what have you found? You just mentioned that it's understudied. So what have you found when looking at all the studies that have been done on pollutants and their health impacts on humans? I guess you found that there's not enough study of how they affect women in particular, right?
Yeah, so there's not much. I mean, compared to 10 years ago, yes, there's been a lot more studies, but the reason why women were actually excluded from clinical studies in science was actually because they were thought to be subjects that meant to be protected, because they could bear children, and so they were trying to make them safe and not expose the fetus to, undesirable outcomes of clinical trials and things like that. And so they said that, let's just recruit men, and because A, men and women are the same and alike, and B, we don't have to deal with things in women that could be variables for studies like pregnancy and menstruation and lactation. But unfortunately, as we progress in science, we've discovered that men and women are actually different.
Really? Men and women are different?
Yeah, and so, I mean, based from genetic standpoint, where, the XY versus the XX chromosome and things like that. And so as I get more into these studies, I've found out myself that in terms of chemical exposures also, when you are looking, for example, at cardiovascular diseases or heart diseases, they used to say that men are more susceptible because women, their hormone levels make them more protective. But when you add chemicals into the mix, that actually changes, and so it's really important to consider these differences.
And so what changes then?
So what happened is that these chemicals that we're studying, and in fact, they're present in our cosmetics and our soaps and things like that. So what they do is they have the ability to interact with sex hormones like estrogen and androgens and things like that. And so based on their ability to interact with these proteins in our body, they elicit, different effects. For example, diabetes. It is women are more prone to diabetes because for the very reason that they have the estrogen, right? And so these chemicals actually goes into the liver, and they activate these enzymes that actually go and react or hydroxylizes the estradiol ring, in estrogen, and create these reactive oxygen species that then, go on
and so that perhaps, are you saying that ups the chance that a woman will get diabetes because of the estrogen and the reaction with these chemicals?
Right. And so when you're looking at a population of people and saying that, they're exposed to this kind of chemical at this dose and at this exposure level, they're less likely to have diabetes and more likely to have liver disease. But then you're like, wait a minute, but then 50% of them are men, 50% of them are women, so maybe these outcomes would actually be different. And so those studies are still lacking in terms of, identifying at-risk population based on sex and gender, and so that's really important.
So at U of L, and you in particular, what are you wanting to look at? What are you wanting to find? What's the next research hurdle you want to jump?
So my primary focus is women's health, and in order to attain that, first I have to establish that men and women are different, and there are sex differences. So that's
and the reaction
stage.
to these pollutants.
Right. So that's the stage I'm at right now, And so what I really want to do over time is to actually look at these exposures and how they're passed on from mother to child, and how, what are the outcomes of these so-called transgenerational exposures, and most importantly, how to raise awareness to people about what we're exposed to and how to deal with it, and to be more aware of what we eat and things like that.
We're talking with Banrida Wahlang, who's from the University of Louisville. She's an environmental health scientist at U of L. And you talked about, the impact on in vitro and on babies of these things being passed down. Is there evidence that if mom is breathing, polluted air that has some of these things in it, that these latent pollutants that have been around forever and ever and ever, that those can be passed along to in vitro to the baby and cause problems in the future?
Yes. There have been some studies, human studies done. For example, there was one done in Michigan where they were looking at pregnant mothers who were consuming a lot of sport fish from the Great Lakes, and the Great Lakes have a lot of mercury and DDT and PCBs and things like that. And so they did this really long-term study where they followed up, on these children that were born to these mothers who were eating this so-called kind of diet, and so they found that they actually had a lower IQ. Apparently these chemicals, and they did tests for these chemicals and find them in their serum, in their blood, and they also look at the IQ levels of these kids, and compared to kids that were born, from moms that had more healthy diets, that were less, fish and things like that, they had a lesser IQ. And
so those neurological disorders or whatever, are those
Right.
kind of the things that you might want to look at in the future?
Yeah.
You might be studying in the future?
Yeah.
Okay. And anything else in any particular area when you're talking about women's health? You talked about diabetes already. We talked about the problems with pregnant women passing along the things. Anything else that particularly interests you?
I have been doing a lot of study with Matt Cave on the liver and metabolic diseases and metabolic syndrome, and that's actually something that I am also very interested in. And
what is metabolic syndrome? What is that?
So metabolic syndrome is a word that was coined, I think, in about 1998. It comprises of a spectrum of disorders. One is hypertension or high blood pressure, and then high glucose levels, which is diabetes, and then obesity, right, and or overweight, and high lipid levels in your blood. Bad lipids versus good lipids, and so that is like a number of disorders. So you can have 2, or you can have 3, or you can have all of them, and so that will dictate how bad is metabolic syndrome. So
Gotcha.
that's something that I would like to look at. And another thing that I'd like to state is, so far in terms of women's health and pollution, a lot of work have been done in this so-called bikini area, which is just breast cancer and ovarian cancer, which is good and it's important, right? But at the same time, other things have just sort of been not stratified by sex or gender, and so that's something that I'm really trying to break
out the impact on men versus women. Banrida Wahlang, I appreciate you being on the show. You're listening to UofL Today with Mark Hebert. Go Cards!